Hi guys, so today's video I'm going to demonstrate an emergency transport. So just a little setup. Our client has been laboring and she just had an SROM, and we noticed, I did a vaginal exam and noticed that there is a prolapse cord. She is in knee chest right now, and as the acting midwife, I am holding that cord for dear life until EMS gets here and they are on their way. So while EMS is en route, I'm going to give report to the hospital staff, preferably either the charge nurse or the attending physician if they're available, which they never are. And this will be my demonstration on how to give report. So I have my little notes here just on the basics that I want to touch on. You want to make sure that you are giving demographic information. Actually, no, that's for EMS. You don't need to give demographic information for the hospital staff. You want to make sure that you give pertinent information regarding their obstetrical history, what was happening during that scenario, any other underlying factors, like if I noticed any abnormal fetal heart tones, or if I noticed any meconium, which we had clear fluid, thank God, in this scenario, and things like that. So that's the information that I want to give. So I'm simulating like I'm calling on hold because I know I'll be on hold. And of course, I'll still have a hand in. So I'll probably more than likely be like this, or the assistant will have the phone on speakerphone, which we've done before. So I can give report as the provider, a thorough report. Okay, so let's pretend the charge nurse has come on the phone, and I'll start by saying, hi, this is Sarah Edwards, CPM. I'm calling to transport Alexis Hardy. We are at a planned home birth, and the reason for transport is we just had a SROM at 2008 and noticed a prolapse cord. I'm currently relieving pressure on the cord. EMS is en route to the house now. So I just wanted to call you and give report. Again, the mom's name is Alexis Hardy. Date of birth 9/10/88. She's a G3P2, 39 and 3 today. No significant prenatal history. It's all been within normal limits. Her vital signs are normal. Last time I checked her, or last check, she was 770 and 0. And her SROM just occurred literally like I said, at 20:08, which is now 3 minutes ago. Fluid was nice and clear. Her GBS status is negative. She doesn't have any history of cesarean section, and there's no EBL right now. There are no medications on board, and I haven't delivered any other therapies as well. Again, EMS should be arriving soon. We're doing fetal heart tones, and the last fetal heart rate I got was 110. So baby's doing okay for right now, but we did have a huge deceleration down into the 80s, but it's rebounded to 110 now and has been stable since. So I just wanted to give you a report. If you have any other questions, please don't hesitate to ask me. And I am having my assistant fax over all pertinent records to you now. What number would you like for me to send those to? And that's how that goes. So I hope I did a good job. So basically, I just gave that clinician the whole scenario as to what's happening. They shouldn't have any questions. Of course, I'm not going to talk that fast because they'll be interrupting me and saying, wait, what? How many weeks is she? What? Did she rupture? Did she do this? Did she? But that's just the core of all of the info that they need to have. They need to know the gestational age. They need to know, obviously, demographic information. Demographic, gestational age, the client's age, how many pregnancies she's had, if there's any complication with this pregnancy ahead of time, what's the situation look like now? Is she stable? Is baby stable? And then we go from there. And I will fax the records over to the hospital that it will be receiving her. Thanks.